Hello, Dr. Nikhil. Very glad that
Good
you
evening,
are
sir.
here today. Yeah. Good evening. Yes, how does it feel on securing rank 3 in DM Pulmonary Medicine INISS 2025?
To be honest, it feels great, sir, to get a good rank in a
Yes.
competitive exam like this. But it's also mixed emotions because I got PGI in my counseling. So I know residency is going to be difficult. But yeah, I'm
Yeah.
prepared for that. Yeah.
Don't worry, you will come out with great flying colors. Now, briefly tell us about yourself, your UG, PG.
Yes. So my name is Nikhil. I come from Kerala. So I did my UG from AIMS Raipur. I'm from 16 batch, 2016 batch. I did
Great.
my PG in MD in Pulmonary Medicine from Government Medical College, Calicut. And I'm just done with my university exams. My results came out about 1 week back.
Oh, great. When did you decide that you should get into DM Pulmonology?
So actually, I had thought of it in my first year itself, but then second year I had kind of mixed feelings about it because many people told me the residency is going to be difficult. But by third year, I almost finalized that I was going to DM. So yeah, by almost the first half of third year itself, I had finalized.
Okay. Most of the undergraduates who have just given their NEET PG exam, whether to choose MD or DNB pulmonology, will also be watching this video. Tell me, when did you feel that pulmonology is made for me and I should choose this branch, and what is the reason?
So to be honest, I never thought of pulmonology in my internship. The thought actually came after my NEET PG exams. Like uh, I would have gotten medicine also, but I want to do a good course from good institute. So I was going to get MD Pulmo in GMC Calicut, but it was after I joined that I fell in love with the subject. I never thought I would fall in love with a subject like this. So yeah, it was a great experience, sir. Like nobody told me beforehand like anything about MD Pulmo, but after I joined, I found it to be an exciting course.
Yes, always true love happen unexpectedly. I think it was the same with you also with pulmonology. And tell me,
Yes.
when did you join resident pulmonology course?
So I think it was in the second half of my third year, I guess. Is when I joined.
Okay.
Like
Okay.
most of my colleagues were using it, my seniors were using it, and even my juniors were using it, and they told me it had almost everything covered in it. So that's how I joined the resident technology course.
So, how did this course help you to tune yourself and modify yourself for the MCQ examination and also your theory practical exam?
So the reason I took the course was mainly for my university exam preparation, because everybody told me it was the perfect place because it covered everything, and I felt the same as well. I think nothing was left out, to be honest. Everything is covered in the form of videos as well as the one-page digest, and even all the exams, questions that came in the Kerala University exams, it's also covered in the course. So it covered almost everything. And apart from that, there's nothing extra I did when it comes to MCQ preparation. Of course, I solved many of the MCQs that are available in the course. But apart from that, I think preparation is the same for whether it's a university exam or the INSS. I think preparation was the same. For INI, the only extra thing was I had to learn medicine. So that's the only extra thing I did. Otherwise, everything was well covered in the course.
And most of the people think that because we are doing pulmonology, you have only one system to see. You may not be that busy. But the truth is, especially during winters and when we deal with a critically ill patient, it will take a lot of time when compared to other system patients. Now, how did you balance your ICU duties, your ward duties, along with that, your regular reading schedules?
So in first year, we don't get much time for studies. So whatever I learned was to answer the questions in our rounds. So that's the only preparation I did in first year. Second year, obviously, it's much more relaxed. We get much more time for studying. But I was reading, sir, like throughout second year, although not with that much intensity, but I made sure I was in touch with the subject. Especially, I started reading Fishman. I went through the important guidelines like COPD, asthma. I knew it was important, but I kept on reading, sir. I was relaxing in between, but I made sure I was in touch with the subject. But it was mostly in third year, like I realized I had to give my 100%. So at least I think 3 to 6 months before my university exams, I started taking preparation seriously. I started watching your videos. I prepared my own notes.
Yeah.
So yeah, side by side, I studied Fishman as well.
Yeah, great. So most of the students ask me, sir, I got into pulmonology just now. I wanted to join your course, and I generally tell them for the first 6 months or 9 months, you take some time, understand your surroundings, understand the work pressure, understand the work culture, and then when they are really ready, so that they can give their good amount of time, I ask them to take up the course. So what is your advice to residents who have just joined right now, how to balance all this?
So it depends on the institute where you're working. Like I think in most places, the first year is going to be difficult. But if you can find some time, definitely start studying early on itself. It's only going to help you in the end. And I think as far as starting the course is concerned, I always thought that I should have joined your course early on. I think it would have made it
Okay.
much easier. So even in first year, if you have time, I would say certainly start with the course. It makes preparation much more easier. Like starting suddenly with your textbooks or guidelines is obviously going to be difficult. So I think starting the course right in first year would be a good option, especially if you have some time left. The whatever free time you have left, just go through the videos, make your own notes. If you don't have time, then of course you can start in second year as well. Like I started in third year and still was able to make good use of it. So start early on. I think that will be my advice.
How did you handle MCQs and wrong answers during preparation? What kept you going?
So to be honest, I kept my MCQ preparation towards the end. I never gave any grand test or anything because I didn't have time. Like my university exams and the INA was in the same month. It was in November, so I didn't have time for that. I obviously solved most of the MCQs that is given in the app, and I went through the revision. I went through the answers, the explanations. So that's the only preparation that I did. Like most of the preparation was based on the theory preparation, sir. Like my 95% of my focus was on the university exams. So it's basically revising the notes that I made, watching your videos, and towards the end, obviously, I solved many MCQs, whatever was available, and that really helped me, sir.
Yes. So your story is a success story, which tells that even if you are preparing for theory exam, if you are consistent, if you are honest and committed, you can crack one of the toughest exam in our country, that is DM Pulmonology INISS, in the first attempt. And one final message to our aspirants who are preparing alongside with regular 3 year residency, something that you want to share with them.
So if you're looking for DM Padma, I think you have to make that choice early on. I think that's the first thing you have to decide. Like for me, it started in first year itself. I had finalized it in third year. So I think that's the first question you have to ask because I think your intensity of preparation will vary accordingly. Like just for passing the university exams, you can just solve the previous year questions and I think you can pass. But if you want to get a DM course, whether it's NEET or INI, I think the intensity of preparation, the depth of preparation should be much more. The topics remain the same, like whether it's a university or the entrance exam, but the depth of preparation it varies if you're going for the INI or NEET SS or the university exams. So for me, whenever I was studying, I had my like thought process that I have to study for INI as well. So I went in depth into the subject. Like after watching your videos, making notes, I made sure I went back and read the chapters in Fishman and the guidelines. So yeah, the depth of preparation is very important, sir.
Yeah, that's really great to know. And now you are in PGI, India's most premier institute. I'm wishing you great success, and I'm looking forward to see you as faculty and helping our residents in future. So thank you so much, Dr. Nikhil. Once again, congratulations and advance happy new year.
Thank you, sir. Happy New Year, sir.
Yeah, it was great interacting with you. Bye.
Bye, sir.